Say that. Oh, it's bad, huh? It's bad. Really, really bad. Oh, there it is.
Well, after the Cincinnati game, or actually during the Cincinnati game, I noticed that Smokey had some lameness, and I tapped the officer in front of me that stands in front and asked them to go have the handler come over if they would and kind of explain what I did for a living. And they came over and they said, yeah, he's just not acting himself. And so we met that night after the game at the clinic and did an evaluation and determined that he had partial tear of the anterior cruciate ligament. And so that's a condition in dogs, unlike people, that's a slow degenerative condition. In people, it's almost always an acute traumatic sporting injury. And so his knee is still pretty stable and he's very functional, and with treatment including rehab and anti-inflammatory medications and joint supplements, we've gotten him back to where he does pretty good, and he's pain-free and not lame. And so we're going to try and treat him conservatively up till the point where if and when he needs surgery, then we would go ahead and do a procedure called a tibial plateau leveling osteotomy on the knee. Typically, routine day in rehab for Smokey is sometimes he gets an injection of a chondroprotectant. He'll get some warm-up activity, some stretching and range of motion, some just light activity over ground, just walking around just to sort of warm the muscles up. And then we'll put him in the underwater treadmill with the water level fairly high so it takes the pressure off of the joints, and that helps to keep the cardiovascular system healthy as well as keeps the muscles that support the joint healthy and strong. And just the fact that they're in water, I mean, we've documented pretty significant increases in weight bearing after just a single underwater treadmill session. There's always concern, I think, about dogs and water. I mean, if you lower a dog into a swimming pool, even like a Labrador Retriever that normally loves to swim, sometimes that is a little bit scary to them. But with the underwater treadmill, they walk in, we close the door and then raise the water level up to the desired height, and then we start the treadmill belt. And very few, if any, dogs really don't tolerate it. I mean, they usually just love it. And he was the same way, just like he'd been doing it all his life. And then we'll do some low-level laser therapy or therapeutic laser and some neuromuscular electrical stimulation and TENS treatment around the joint. I don't know whether he knows that things are different or not. He certainly seems to enjoy the tension. I mean, I looked over and he's laying there letting people rub his belly and pet him and everything, so he seemed happy.